2020 has been a challenging and unprecedented year, and APHON has adapted to the new normal of COVID-19 as our members have at their institutions across the country. Although it's been a challenging year, APHON has been very active and effective at supporting pediatric hematology-oncology nurses through advocacy.
APHON actively engages our members in legislative and regulatory issues, and we advocate for legislation that is vitally important not only to our membership, but to the nursing profession as a whole. I'm really happy to share with you that during this last year, APHON contributed to the Title VIII Nursing Workforce Reauthorization Act becoming law through the CARES Act. This was an emergency COVID-19 relief package of legislation, and it will provide much-needed support for nurses during this pandemic as well as beyond. Title VIII provides education and training for nurses. It provides for nursing workforce diversity, as well as nurse retention and student loan funds for nursing schools. APHON and our coalition partners sent letters to Congress, we attended meetings, and submitted written testimony in support of Title VIII. For Title VIII, as well as other legislation, we have provided our members with the tools that they need to be able to make virtual meetings with members of Congress. We did this through the APHON Advocacy Training Grassroots Nurses webinar and provided continuing nursing education for those who completed the training.
APHON has shared our accomplishments and kept members updated on legislative and policy issues impacting the profession of pediatric hematology-oncology nurses and our patients through our newsletter, The Advocacy Correspondent, which we published in June and September. We also engaged members and launched grassroots advocacy campaigns through Voter Voice, which allows APHON members to send letters of support directly to their members of Congress. APHON joined the Alliance for Childhood Cancer's Virtual Day of Action on September 9th to support funding for the Childhood Cancer Survivorship, Treatment, Access, and Research Act, the STAR Act, with a social media campaign via Twitter and 2 grassroots campaigns through Voter Voice.
In September, the APHON annual conference went virtual, and advocacy had a major presence at the conference. APHON welcomed Congresswoman Lauren Underwood, one of our nurses in Congress, who gave the closing remarks and shared a special message with our members. Looking ahead to 2021, APHON will continue to build on the increased advocacy presence. In late 2020, several committee members attended a congressional briefing on sickle cell disease hosted by our coalition partners at the American Society of Hematology and the Sickle Cell Disease Association of America, in conjunction with Senators Tim Scott and Cory Booker and Representatives Danny K. Davis and Michael Burgess. APHON will continue to increase our advocacy efforts on behalf of hematology patients in 2021, specifically those with sickle cell disease and sickle cell trait. This will allow us to more directly address health disparities experienced by many of our patients of color. As 2020 is an election year, APHON has worked diligently to plan our advocacy strategy and priorities for 2021 and beyond.
APHON's advocacy and government relations efforts have been strong throughout 2020 and will continue to thrive in 2021. Members will continue to be brought into the conversation and given opportunities to participate in grassroots advocacy for issues impacting pediatric hematology-oncology nurses and our patients.